So today, let's talk about root canal treatment, root canal therapy. Let's talk about it because a lot of times the general public, it's not explained to them at all or even correctly. And when they come, to a dentist in the future, they typically are confused because in their mind, they say, well, I shouldn't have a root. The root was removed. And so they're trying to process what exactly is going on. So here we have a tooth, and sticking out of this tooth is actually these rubber cones known as gutta percha. So after the dentist, endodontist goes through all of the steps to clean the tooth out and start the process of filling, that's whenever they're going to use this rubber material. Now, you might say, well, how do I know if my tooth needs root canal treatment? Well, typically, if the tooth has suffered some kind of trauma, major trauma, or if the decay is to the point where it's into the nerve, then the doctor has to do that root canal treatment. So once all that decay is removed, or once the nerve has been accessed, the pulp chamber, then at that point they're going to start the process to clean the tooth out, prepare it, and then of course fill it with this rubber material. So I just wanted to show everybody here these little rubber conical points. So they get placed inside the tooth, inside the canals. So root canal, everybody has a root canal. It's the space that's filled with the rubber material. Then this is actually cut off on the top, and then of course it's filled with a permanent restoration. And a lot of times you put a crown on top of the tooth, because once you do this root canal treatment, you've removed any remaining vital nerve, nutrients, blood supplied to the tooth. So the tooth is dead. Now, what happens over time is, because it's lost all that nutrients and that nutrition, what's going to happen is the tooth, a lot of times it turns colors. That's why on his front teeth you see that it turns brown or gray, and it's weakened. It's more susceptible to breaking. So a lot of times they're going to prepare this tooth and put a crown on it. So very important that your patient, if you're a patient or your patients, it's very there's a misunderstanding, because a lot of times you're just giving them the price or the insurance copay for the root canal treatment itself. Meanwhile, even though it is a separate procedure, it is something that coincides with it. So very important that a patient understands that hey, the root canal copay is X, but then eventually we're going to put a permanent restoration in it, that core, and then we also have to prepare it and cement a crown on it. So hope this helps. I like the visual of the gutta percha. So please feel free to ask any questions. And of course, check out our video catalog. I've done some other in-depth videos as far as root canal treatment goes. And if you have questions, feel free to comment, drop us a message, and we'll gladly put together any topics that we can. So hope everyone has a great day, and we'll talk to you soon.